For my part, I will be explaining the introduction of ALPORT syndrome based on the information shown on this poster. ALPORT syndrome is a genetic disorder that mainly affects the kidneys, and it can also involve hearing and vision. It affects important structures in the body, particularly those involved in kidney function as well as hearing and eyesight. ALPORT syndrome is considered a rare disease. It affects approximately 1 in 50,000 people worldwide, which means many people may not be familiar with this condition. Despite being rare, it is clinically important because it can have long-term health effects. The disease is caused by mutations in genes that produce type 4 collagen. Type 4 collagen is a key structural protein found in basement membranes, especially in organs such as kidneys, ears, and eyes. When this collagen is abnormal, it leads to the development of ALPORT syndrome. In terms of inheritance, ALPORT syndrome can be passed down in several ways. The most common form is X-linked inheritance. However, it can also be inherited through autosomal recessive or autosomal dominant patterns, depending the specific gene involved.
Now, let's talk about the genetic mechanism in ALPORT syndrome. ALPORT syndrome is inherited in an X-linked pattern and caused by the collagen 4 alpha 5 gene mutation that is located in the glomerular basement membrane of kidney. It also can be inherited in an autosomal recessive ARAS or dominant pattern ADAS that is caused by the gene mutation in collagen 4 alpha 3 and collagen 4 alpha 4 gene. Type 4 collagen gene is important for the glomeruli in the kidney. Hence, mutations that occur cause abnormalities that lead to the improper filtration in the kidney. It also causes sensory neural hearing loss and vision problems. Next, type of mutations in the collagen 4 alpha gene includes the most common mutation, which is the missense mutation, where glycine residues are affected, that it disturbs the formation of triple helix in the collagen 4 alpha gene. Next is nonsense mutation. This mutation causes immature stop codon that leads to non-functional collagen chain. Other than that is inversion. For example, an inversion of 21 MB with proximal breakpoint in collagen 4 alpha 5 intron 8 at XQ22.3 region. Lastly, large intragenic deletions that involve deletions of exons 1 to 6 in the collagen 4 alpha 5 gene. So how does the break cause the disease? The normal alpha 3, alpha 4, alpha 5 collagen network in the glomerular basement membrane is replaced by the alpha 1, alpha 1, alpha 2 collagen network chain, which is structurally weaker and also more susceptible to the proteolytic degradation. Hence, this leads to the thickening, thinning, or splitting of the glomerular basement membrane. Defective collagen 4 alpha fails to synthesize collagen 4 alpha chain as the formation of triple helix is disturbed, as it might be misfolded or not produced at all. Lastly, it also fails to maintain the strength and the function of glomerular basement membrane, and this leads to hematuria and also proteinuria.
Assalamualaikum warahmatullahi wabarakatuh, and hello everyone. So today I would love to talk about diagnosis of ALPORT syndrome. So, ALPORT syndrome is a genetic condition that mainly affects hearing, kidneys, and also eyes. Because of the symptoms can develop slowly, early and accurate diagnosis is very important to prevent a serious kidney failure or kidney damage in the future. The first step in diagnosis usually starts with taking the patient's family history. Doctor will ask if there are any relatives who have kidney disease, hearing loss, or vision problems because ALPORT syndrome is inherited. Next, urine tests are done to check for blood and protein in the urine. Blood in the urine, which are also known as hematuria, is one of the earliest signs in this condition. Blood tests are also be carried out to evaluate kidney function by measuring the substance such as creatinine and also urea. In addition, hearing tests that are known as audiometry are performed to detect early hearing loss even though the patient does not notice any symptoms yet. Eye examinations also are be done, and it is important to identify the abnormalities in lens and also retina that are commonly associated with ALPORT syndrome. Next, if the diagnosis is still unclear, a confirmatory test will be done, which is kidney biopsy. This will allow the doctor to examine the kidney tissue under a microscope and observe the change in characteristic of the basement membrane. Finally, last but not least, genetic testing is the most definitive way to confirm ALPORT syndrome. It looks for changes or mutations in specific genes. For example, COL4A3, COL4A4, and COL4A5, which are affects kidneys, ears, and also eyes. This test helps to confirm the diagnosis and also to understand how the conditions may run in the family. In conclusion, the diagnosis of ALPORT syndrome involve a combination of family history, laboratory tests, clinical examinations, and also genetic analysis. Early diagnosis allow a better management of the disease and helps to improve the patient's quality of life. So that's all from me. Thank you.
Now, let's move to the symptoms part. It is important to remember that symptoms of ALPORT syndrome can differ from one person to another, depending on the type of mutation and how severe the condition is. Individual symptoms can include blood in the urine, also known as hematuria, which is often the earliest sign and may appear during childhood. Some patients may also have protein in the urine or proteinuria, which shows that the kidneys are starting to lose their filtering ability. As the disease progresses, hearing loss may develop, usually during late childhood or adolescence. This happens because the inner ear, which is important for hearing, is affected by the abnormal collagen structure. The hearing loss is typically gradual and may not be noticed at first. In terms of eye involvement, some individuals may experience abnormal pigmentation of the retina, known as dot and fleck retinopathy. While this usually does not cause vision loss, other eye problems can occur, such as nearsightedness, lens opicities, or a cone-shaped lens called anterior lenticonus, which can affect central vision. Other symptoms may include swelling or edema, especially in the legs or around the eyes. Due to poor kidney function, some patients may also experience joint discomfort, osteodystrophy or loss of bone density, which are linked to long-term kidney problems and mineral imbalance. ALPORT syndrome is caused by mutations in type 4 collagen, which plays an important role in maintaining the structure of the kidneys, eyes, and inner ear. Because these tissues rely heavily on this type of collagen, damage to them leads to the specific symptoms seen in ALPORT syndrome. In summary, ALPORT syndrome affects multiple organs, and its symptoms usually appear gradually over time, starting with the kidneys and later involving hearing and vision. Early detection is important to help slow disease progression and manage complications.
ALPORT syndrome is a genetic disorder caused by defects in type 4 collagen, leading to progressive kidney disease, hearing loss, and ocular abnormalities. Since there is no definitive cure, management focuses on slowing disease progression, treating complications, and providing supportive care. The most important aspect of management is renal protection. Early initiation of ACE inhibitors such as enalapril or angiotensin receptor blockers is recommended to reduce proteinuria and slow the progression of chronic kidney disease. Blood pressure should be closely monitored and maintained within normal range. Regular follow-up with urinalysis, serum creatinine, and estimated glomerular filtration rate is essential. As kidney function declines, patients may progress to end-stage renal disease. At this stage, renal replacement therapy is required either in the form of dialysis or kidney transplantation. Kidney transplantation is the preferred long-term treatment as ALPORT syndrome does not recur in the transplanted kidney. Hearing management is also important. Patients should undergo regular audiological assessments. Sensory neural hearing loss is treated with hearing aids, and cochlear implants may be considered in severe cases. Ocular involvement requires regular ophthalmologic examinations. Vision problems such as anterior lenticonus can be managed with corrective lenses or surgical intervention if necessary. Genetic testing and counseling play a crucial role in management. Family members should be screened, especially in X-linked cases, and genetic counseling helps patients understand inherited patterns and future risks. In conclusion, early diagnosis, renal protective therapy, and multidisciplinary care are essential in improving outcomes and quality of life for patients with ALPORT syndrome.